issues. How can we help these? Because I think medics are trained to keep secret of the patient, but you find it that when you go to the hospital, they start talking about, oh, that boy is young, or that the lady, she's young but has this and that. How can we handle it? Yeah, thank you.
I have a question.
Yes, go ahead.
I'm asking, how can we address young youths outside there that to know the importance of getting
Who is
treatment
this?
of
It's called
STI?
Samsung. Then what's your name?
Me, I'm Robert. Hello.
Yes, Robert, go ahead.
I'm asking, how can we address the youths outside to know the importance of getting treatment for STI?
We can have the doctors respond to those questions we've had before I go to read the comments in the chat box. Okay, so Doc, you might want to respond to the questions. Then I'll read the ones on the chat box.
Yeah, thank you. So I start with Rose. Rose asked whether people are advised to go and take herbs. Somebody takes as much as 5 liters of herbs to get cured. Of course, the herbal medicine we used to work before this conventional medicine came, but we don't know how much of the dose they are taking, and we don't know how effective those drugs are because they have not been tested. And sometimes you might be taking them and really postponing the treatment. So what I would advise is in case anybody has any problem, please just go for checkup so that they rule out the problem, because you might be taking the herbs and just suppressing the symptoms, but not eliminating the virus, the bacteria, or the fungus. The herbs may just be suppressing the symptoms, but not really eliminating the bacteria itself. So I would advise that if you have a condition, please go to the hospital so that the doctor checks you up, so that we know what is the problem. Then Nelson Waore said that there's a girlfriend here. Somebody has a girlfriend, and the boyfriend is positive. And I didn't get the question very well. I think he was wondering what should he do when you have a girlfriend and the girlfriend is negative, and the boyfriend is positive. If you must have sex, then we have what we call a pre-exposure prophylaxis, which prevents people from getting HIV. So if somebody is, if we have a discordant couple, one is positive, one is negative, then we have a drug we call PrEP. PrEP prevents the person who is negative from getting infection. And also we have the use of can protect one who is negative from getting the infection. For example, if you are married and one of the partners is HIV positive and the other one is negative, then we can use the prevention. And if the person who is positive is on drugs, is on ARVs, and is taking the medicine consistently for 6 months, then the viral load drops. So when the person who is positive is on ARVs and is taking the medicine as prescribed by the doctor consistently, then when the viral load drops below a certain level, then he will not be able to transmit the virus to the partner. And the partner who is negative, also using PrEP, will also not be able to acquire the infection. And if they're also using condoms, then that will be, if now you're using both the three, the one who is positive is on ARVs, the one who is negative is on PrEP, and both of you are using condoms, you are very protected. That was Nelson. Then we go to Samson, was asking that his girlfriend or a girlfriend has a rash over the body. So he was not sure what is this rash all about. Doesn't mean that all rashes are STIs. There are some rashes that are just skin condition. Yeah, some are heat rash, some are because of the adolescent stage when girls are developing from childhood to adolescent. There are hormonal changes that bring rashes on the face. You have acne. So those rashes could just be because of the hormonal changes in adolescence. So it doesn't mean that if you see a rash in any person, that guy has an STI. No. go to the hospital for checkup so that the doctor can advise whether the rash is a normal developmental circumstance, changing from childhood to adolescent, and the hormonal changes are bringing the acne and those rashes on the face. So you better go for checkup at the health facility. Doctor will advise you. Owaga VC was worried because people are educated, people are informed, but they have symptoms, they ignore the symptoms, they wait for the conditions to complicate, and was wondering what should we do to educate people on STIs? And also, he was so worried because of negligence that people are not taking care of themselves. In fact, that's why RHAY is here, so that people can be informed of this STI. Sometimes somebody can, just ignore because he doesn't know. Lack of information is really a disaster. But if you know, like now you've seen the pictures. If you see something on your body with such pictures, then you will take steps to try and treat yourself. And you was also talking about people going to buy drugs over the counter to treat themselves. Please don't go and buy any medicine over the counter for treatment if you're sick. Go for checkup. Let the doctor confirm exactly what you're suffering from so that you're put on the correct medication. He also said that people who have gotten VMMC think that they are protected. They are not. VMMC only protects men 60% of the time. So what about the 40%? So you need to use condoms. You also need to take care of yourself. It only protects 60%, so it's not 100%. So those people who are having VMMC need to take care of themselves and their partners. Jerome Obwar, how can it be made affordable? STIs are not very expensive. I mean, STI treatment, if you go to a health facility, they're not that expensive. So if you think you have an STI, please just walk to a dispensary health center or a hospital, then explain yourself to the doctor. They'll give you the treatment. It's not so expensive. The problem is stigma. That's what Jerome was worried about. People fear going to the hospital, the stigma that the adolescents have in the community. So they sort of fear to go to the hospital. Please, don't you fear. There's treatment. And I think the RHAY program should be look into this. How do we advocate for stigma reduction among adolescents and also among healthcare workers? I think we can discuss that later so that we make things better for the youth. Beryl, you were worried because some symptoms take long to appear. Remember I said in syphilis, if you ignore it at the primary stage, you've seen a wound that is not painful and you ignore it, you don't go for treatment, then it disappears without treatment. So you think it's okay. So if you see anything in your privates, please take steps to go for checkup, because if you ignore it, like in syphilis case, the symptoms will disappear without treatment. Then it will come back again with a rash. You might also ignore it because the rash is not itchy. Then it disappears again. It goes into latent stage. You ignore it because you're not seeing any symptoms, you don't have anything. Then it comes back later when it is now worse. Or you have cancer of the cervix. Yeah, you're going for pap smears every time that you're supposed to. Then they find there's a problem. They need to treat it and manage it at stage 1, because if they ignore it, it goes to stage 2, stage 3, stage 4. Then that becomes care of. How do you address the friendliness between the healthcare workers and the young people? I think this is one of the issues that RHAY is advocating for. Winnie, you'll say something about that. So there's the RHAY advocacy component of RHAY, so that advocate for the adolescents. They should get access to services and treatment. Then Robert, how can you help young people outside here, because they don't know? They don't have information. In fact, that's why this platform is here. Because you can listen to this even in your rooms or on your phone, because it's a social network platform. You can listen to it. And this information, if you have it, it will empower you to seek for treatment. Winnie, I think I've answered. I tried to answer most of them for the time. Maybe you can pick up from there.
Yes, Doc, thank you so much for answering them very comprehensively. So I'll quickly run through what has come in through the chat box, and what you have responded to, you just ignore. So let me read. I've been noting them down. So we have about 35 responses here, or reactions or questions. So the first one is, I have been doing a project with Leave No Youth Behind, mostly based on youths and young care leaves. And I think most youth are really affected by this STI and STDs and fear to go to hospital. Also, drugs are expensive. Can this be introduced free to health facilities, especially for young caregivers? Okay. Hello, Ray. Most youth go for natural medicine. I think that has been responded to. Recurrent infections, especially UTI, you take medication and follow prescription, but still you go back, you find still you have. What is the reason behind? And also, can recurrent UTI cause cervical cancer? So this question is just talking about recurrent UTI, and can recurrent, please mute.
Hello.
Please, no, wait first. I'm reading the questions, then after I'm done, then we'll also give you an opportunity to ask the question. Just mute. What is the reason behind, okay, this question is about what is the reason behind recurrent UTI, and can recurrent UTI cause cervical cancer? And then we also have, can gonorrhea affect backbone? Can gonorrhea affect backbone? And we also have, can gonorrhea make newborn child blind when the eyes start releasing pus? Kindly help me distinguish this. I once had some pimples in my vaginal lips. They produced pus and are very itchy. Was it an STI? It usually happens when I'm almost having my menses. If you have white on the penis, so this is just how the question was left. If you have white on the penis. And another one is, what about the rashes on the skin? So I think this is talking about general rashes on the skin. Does that, matter? Is that related to any SRH? Why is it that those affected by HIV are the most to get HPV virus? Another one is, what about, okay, this is same question. Another one is, I am concerned why females, even the learned ones, are not keen with their vaginal health. Is it a hard thing to keep? Please share the slides. They are very educative and clear. How can someone get HPV? Another question is, you find a whole minister or health professional misdiagnosing. Misdiagnosis, exclusive test is another problem we face in health facilities. So this is just talking about misdiagnosis. And do we assume all with mapped tongues to have latent syphilis? Should we assume those with mapped tongue to have latent syphilis? Another one is, you have a girlfriend and the boyfriend has HIV and they have to have sex. What can you advise? So discordant couples, how do you advise them having sex? You might be faithful, but your partner is not faithful. Hence, you might be infected. That was just left like that. Is it true that human papillomavirus males are the main host? Is it true that males are the main host of HPV? Is UTI an STI? Yeah, is UTI an STI? Hello, doc. Can one be diagnosed for all the STIs when he or she goes for the screening? So can screening help to diagnose if anybody has, all STIs or all forms of all types of STIs? Please address this. At what age should sex education, reproductive health education be introduced in Kenya? At what age is sex education proper to be introduced, by the law of Kenya? Or, also for other people who are outside of Kenya, what is the good age to introduce sex education to your kids or to young people? Is it high time we invest in documented treatment history available to all health facilities once a patient visits a hospital? This will be one stop for early diagnosis and treatment. Another question is, who are the most at risk of becoming infected with STI, men or women? Another question is, hello doc, can one be diagnosed for all the STIs when they go for screening? This has already been raised. Another question is, at what age? This has already been addressed. Lastly, washing the penis or the vagina after sex will lower the risk of being affected with STI. This is just a statement, but maybe I should ask it as a question. Does washing the penis or vagina after sex lower the risk of being affected with STI? So those are the questions, Doc. I believe you can respond to the ones you can respond to.
Okay, thank you. Thank you, Winnie. The first one was about most youths cannot afford medicine. I think if you go to the health facility and you explain yourself, the doctor there, they can see what to do. But most of the drugs are not that expensive. If the STI drugs are not that expensive, they're very cheap. So if you go to the hospital, they prescribe. If they don't have it, you can afford to buy them. They're not expensive. Somebody also asked about recurrent UTIs. UTIs are not STIs. UTI is urinary tract infection. Urinary tract infection is an infection that follows the urinary tract, the urethra, the kidneys, the bladder, because of some other infections. So urinary tract infections are not STIs. STIs are sexually transmitted infections that are caused by sleeping with somebody else. But urinary tract infection can be caused by other bacteria that affect the urinary tract. So they are not the same. And somebody was asking, can recurrent UTI cause cancer of the cervix? No. Cancer of the cervix is caused by human papillomavirus and the predisposing factors that I mentioned. Remember, I said that if you start sex so early, and if you have regular partners who are multiple partners, you're exposed to having of the cervix. You remember I said that sexual activity that starts earlier than 18 years, having many partners, and those many partners having several partners. You have one partner who's having many partners, you are predisposed to cancer of the cervix. And also you can go for screening so that you diagnose it early for treatment. Somebody asked, can gonorrhea cause backbone, affect the backbone? No, gonorrhea does not affect the backbone, but gonorrhea in women, it can complicate to pelvic inflammatory disease. And the pelvic inflammatory disease affects the uterus, the fallopian tubes, and the ovary. And if you have the pain in the pelvic organs, you have the pain in the inflamed uterus, inflamed fallopian tubes, inflamed ovaries, you might feel the pain at the back. So that doesn't mean that you have a backbone. You'll be having the newborn babies who had gonorrhea and didn't go for a clinic and was not checked and was not treated, and the baby go blind. Yes, if the baby is not treated, of course that infection will affect the bacteria, will affect the pupils and the eyes, that can lead to blindness. So it's important that when the baby is having that infection, he goes to the hospital so that he's treated, because it's treatable. It's treatable. And somebody asked whether he developed some rashes around the vagina, some pimples that were itchy, and she was saying that most of the times towards her period. Remember, I said that herpes genitalia, when you have it, it stays with you for life. So it's likely that you could be having herpes that comes when the immune goes down a little, or so for us to make the right judgment, please organize yourself. When you have those rashes, go to the hospital so that the people can check, the doctors can check you up and really ascertain whether it is a HPV, is herpes, or is it just a rash. Yeah, you can have a patch on the penis that could either show that you have an HPV infection or not, or you have a fungal infection. Could be a white on the penis, could be either HPV or a fungal infection. So if you have a patch in your penis, please go for checkup so that the doctor can rule out what it is. Rashes on the skin. Rashes on the skin doesn't mean you have an STI. There are so many other conditions that come with rashes on the skin. You can have a heat rash. Yeah. You can have any other type of rash. You can have a skin infection. So just go to the health facility so that the doctor can rule out what the rash is all about. Doesn't mean that if you have a rash on the skin, then you have secondary syphilis. No, doesn't. Somebody asked HIV gets HPV virus? I didn't get that question very well. Yeah, so female not.
Actually, Doc, the question was, how come that most people who are HIV, that it is mostly that people who are HIV positive are most,
immune system, immunity is down, so they're exposed to other infections.
Yes.
There should be opportunistic infections. The other opportunistic infections comes because of the low immunity, so maybe that's why. So how did you know that the guy has an HPV? Because HPV you can't see. It causes other infection. You cannot see it. Yeah, so it's not easy to see HPV infection. HPV causes other infections. So the other one was about female not learned. The other one, Winnie, can you remember it? Female not learned once. There was HPV. How can one get HPV? Something like that. I was writing in a hurry. After the HPV, after HIV, can somebody with HIV get HPV? There's a following question.
Yeah.
What female?
How can someone get HPV? So there's why is it that those affected by HIV are the most to get HPV? And then there's a question on the rashes. And then I am concerned why females, even the learned ones, are not keen with their vaginal health. Is it a hard thing to keep it? Yeah.
That was the question, yeah. Vaginal health is critical. And most people think that the more they wash their vagina, the cleaner it becomes. In fact, the more you wash your vagina, the dirtier it becomes. Because when you wash inside your vagina, you are interfering with the normal environment that is there. The vagina is not supposed to be washed. The vagina washes itself. You just wash the lips outside, but leave the vagina alone. Because if you interfere with that environment, you're going to interfere with the normal bacteria that is there. We have the normal bacteria there that creates its own environment. We call it lactobacilli. It is there. So it feeds on other sugars in the vagina to create lactic acid that makes the environment acidic. So if you introduce bases like soap, you are diluting the acidity in the vagina. So if you dilute the acidity in the vagina, you are interfering with the normal environment. And you know the vagina, the anus and the vagina are very close. So if there's any bacteria at the anus, it can cross very easily to the vagina and cause infection. So vagina should not be washed. If you have a fungal infection, you have a discharge that is like itchy, go to the hospital, you are treated. After treatment, don't wash inside. So they need to be educated. Even those girls who are educated, they don't know. So unless they're told. Misdiagnosis, The hospitals, yes. If you don't go to the proper hospital, then you'll be misdiagnosed. But if you go to a health facility that has qualified doctors and clinical officers and nurses, then they give you the proper management. But if you go over the counter and the pharmacy and buy drugs, then you might get drugs that are not really in tandem with your condition. Marked tongue. Marked tongue. Not all marked tongues are secondary syphilis. There are some people with normal marked tongue. So if you have a tongue that is marked, like the map of Africa or map, you see some maps, please just go for checkup. Some are very normal. So not all marked tongues are because of syphilis. Yeah. So syphilis has specific signs in the tongue. If you go to the hospital, the doctor will advise. You are so faithful, your partner is not faithful. What do? That's a difficult question. That one you need to sit down with your partner and discuss. And if you can afford, can you go together to the hospital and get advice? Because there are so many things that are coming in, especially STIs, that if you're not faithful or if you're having multiple partners, you'll expose yourself to other conditions apart from HIV, because even HIV, you'll be exposing yourself to HIV alongside the STIs. I've talked about STIs and UTI, that one I've cleared. Somebody asked whether the males are the hosts of HPV. Yes, they are. It is the men who harbor the HPV, and then they transmit that HPV to their partners. That's why we advise that most men who are not circumcised, they should go for male circumcision, because the HPV virus usually is harbored under the foreskin. So if they're circumcised, they'll be better off. Can one be diagnosed with all the STIs if he goes to the facility? Yes. If you go to the facility and say you want to be tested for all of them, you can be tested for gonorrhea, can be tested for syphilis, can be tested for chacroid, can be tested for all those other STIs. If you want to be tested, then they rule out all the STIs. If they find one, they put you on treatment. It's possible. Age for sex education. This is a policy question that the government should come up with a policy where to introduce it. Though sex education should start from home, not from school. Sex education should start from the parents, the mother and the father. They should know how to start introducing sex education at home, so that when the child grows up, he knows this is a girl, this is a boy. They should also know the consequences of being a boy, the consequences of being a girl. And if somebody plays around with your reproductive system, what should you do? So that should start from home, right from the house where the child is coming from, not even the school. High time, what? Who is at risk of STIs, male or female? Everybody's at risk. Everybody's at risk of STI. If you sleep with anybody or you have sex with anybody with an STI, you will get an STI. Everybody's at risk of getting an STI. Washing the vagina, I've explained this. Unless, how was it, Winnie? The washing. Hello?
Hello, Doc.
How was the washing asked? Maybe I didn't write it properly. Washing the private parts. What was the last one?
It was the last one?
The one you asked, you read last.
The last washing the penis or the vagina after sex,
yes.
Does that lower the risk of being infected with an STI?
Oh, okay. So, as I said earlier, you're not supposed to wash inside the vagina after sex. After sex, the semen is clean, it's not dirty. And you are supposed to wash outside, don't wash inside. Because if you wash inside, you're going to interfere with the environment in there. So it doesn't reduce.
Thank you, Doc. So we don't have any further questions. No more questions. Risk of being affected this day. Washing. Okay, so that was the last question. Thank you, everybody, for tuning in. Thank you so much, Dr. Bernard Ayeko from Kenya, for volunteering to be our expert.